Scene. Good afternoon, Mrs. Jones. I'm Nikki. I have been your nurse actually last week. I don't know if you remember.
Yes, I do. Yes.
Okay, great. So you get to go home today.
Woohoo!
So that you're obviously feeling happy about that.
I can't wait to get out of here.
Okay, that's great. I know myself and some of the other nurses and professionals have already talked with you about some of the things that I'm here to talk with you about today, but I just really want to make sure that before you go home that you have everything you need, and that if you have any questions that this is a good time to ask them. You can ask anything.
Well, honestly, I'm excited to get out of here, but I don't even remember my stay. Everything's been a blur since I got here.
Would it be helpful if I went over everything that's happened since you arrived?
Yeah, that would be great.
Is that all right if I have a seat? Okay, great. Okay, now feel free to stop me at any time if there's something you don't understand, you want a little bit more explanation on, okay?
Okay.
All right. So let's start with your health history. So you're 28 years old, and at 21 you were diagnosed with type 2 diabetes?
Yes, yeah.
Okay. And you were given a medication, metformin.
Yep.
And you were taking that, but then 1 year ago you stopped taking it. Is that correct?
Yes.
Okay.
Yeah.
So can you tell me a little bit about why you stopped taking metformin?
Honestly, it was too expensive. I had no money because I lost my job. I wasn't able to afford it. It was either take my medications or have food and power.
I imagine that must have been a very difficult time for you.
Very.
And you have a little girl?
Yes. Yep.
Sasha?
Yes,
okay.
Yep.
How's she been handling everything?
Really good. She's a little worried about her mom, but luckily my mom is able to watch her, so I have a good support system.
That's great. And your mom's here, I think, in the visitors lounge.
Yeah,
right?
I was just talking to them. They're actually just waiting for me to get out of here. They're in the visitors lounge.
That's really nice that they're able to be here and to help get you home and get you settled as well.
For sure.
So it was actually your mom who called the ambulance. It was about 21 days ago. She went to pick up Sasha, and she found you in bed, and you weren't looking too good, weren't doing too well. You were looked quite ill, and she called the ambulance, and they brought you into the emergency department.
Yep.
Okay. And when you got there, the team noticed a few things right away. Your heart was beating very fast. You were feverish, and there was a little bit of blood that was around your eyes, and you had some bruising and some red spots over your abdomen. And on your lower left leg, they found a wound, and it looked like it was infected. So they did an assessment on you, and they noticed that when they pressed on your left posterior, the back of your back around the bottom, that it was a little bit tender. They asked you some questions. They noticed that you were a little bit confused. So they did some tests. So they tested your blood, and that showed that you had a bacterial infection that had spread into your body. They noticed that your blood sugar levels were quite high, and they also saw that in your blood there are some things that help control when you're bleeding and when it sort of clots or forms a plug to stop bleeding. And they noticed that those things were not working quite properly. And then another thing they noticed is that your kidneys were not working properly. You were not expressing a lot of urine. So what they did is they got an ultrasound machine and they could see that your blood flow in your kidney was impaired. It wasn't working the way that it should be, and that there was a little bit of inflammation. Okay, so
like, what do you mean by all of that?
I know it sounds like a lot, so I'm gonna go through it all a little bit with you, and let me know again if you want me to slow down or go over something a little bit more.
Okay.
But what happened is that the wound in your leg that was infected, the bacteria from that infection actually got into your blood. From there, it spread around your body and caused infection and problems in other areas. And you may have heard this term sepsis. That is what we called it. It's a systemic infection, infection throughout your body. And when your body becomes infected, it tries to fight it. And it does this through elevating your body temperature, the fever you were experiencing. The bacteria don't like how warm the body is. It's not a good environment for it. So it makes it hard for it to replicate and spread. But sometimes the way your body fights it can actually cause other problems in your body.
Okay.
So in your case, another body system was activated, only it wasn't working the way it was supposed to. And this is what we call disseminated intravascular coagulation, or DIC for short. Another term you may have heard, but let me explain exactly what that means to you.
Okay.
When you cut yourself, your body tries to plug the hole. It forms a clot. And that's to stop the bleeding. But because of some of the way your body was reacting to fight the infection, your body started making clots all throughout your body in different places. And that used up all the stuff your body has to make clots. And then you didn't have any left to be able to make clots to stop any other bleeding that may have been occurring.
Okay.
And because of the infection, you had blood that was leaking out of your veins in small amounts.
Okay, so why would it leak out of my veins?
That is because in order for your body to fight the infection, the parts of your body that fight it travel through your blood to get to where they're going. It's its transportation. But then it needs to get out of the blood and into your tissues to be able to do its job. When it's coming out of your blood circulation, some of your actual blood was leaking out with it. And that was what we were seeing with the blood around your eyes, and with the bruising and the red spots that we noticed under your skin. That was from the blood that was leaking out. And your body, unfortunately, did not have a way to be able to plug that bleeding and to be able to stop it.
Okay, so all of that over a wound on my leg?
Yes. Actually, when you have diabetes, and if your blood sugar levels are not controlled, it actually slows down your healing time, and it makes you more prone to infection. It can cause all sorts of health problems, which is why it's so important that we do control your blood sugars, and why we're going to talk a little bit about that today, so that we can help prevent this from happening again.
Okay, so what do the doctors and the nurses give me? Because I feel so much better now. I want to know what I can take in case it happens ever again.
Absolutely. Well, I'm going to take you through your treatments, but I also want to let you know that we have set you up an appointment at the diabetes clinic, because we've helped get your blood glucose under control. And I know that you do know a lot about diabetes, but we want to make sure that you learn everything you can, and maybe some techniques outside of medicine that can help control your blood sugar levels as well. Okay? So, now I'm just going to get your treatments out here. Okay. So before, well, I'm going to talk about, we'll start with the emergency department, okay? So when you arrived in the emergency department, you were pretty sick, and they realized that you had the sepsis infection, and to treat that, we needed to give you lots of fluids into your body. So we inserted that with an IV, and the fluid is important because of all the leaking from your blood vessels. We need to replace that. We need to make sure that your blood pressure remains stable. And we needed to get antibiotics into you because we really needed to start fighting that infection. And we gave you oxygen because we want to make sure that your body has enough oxygen. Your body uses oxygen as a fuel. Your cells use it. And with what was going on with your kidneys not working properly, we needed to make sure that the fluids were going through there, the oxygen was getting through there, so that when the antibiotics started doing its job, we could make sure that any tissue or parts of your kidney that were not working properly would have the fuel that it needed to be able to repair itself and for the body to do its job. After the emergency department, we moved you into the intensive care unit because you weren't quite ready to leave home yet. We needed to make sure that we got the infection under control and make sure that there were no other complications. But while we were there, we got to know a little bit more about you. And we discovered some of the things that contributed to you ending up in hospital. So we expanded our treatment plan to help with some of the things in your life you told us that you needed a little bit of help with. So one of the things you told us about is that you've been having some financial struggles, and it's been really affecting your life. You could not afford the medication, the metformin that you were taking. So after we got your blood sugar levels under control, we had a nutritionist come and visit you, and they were able to talk with you about how what you eat can also affect your blood sugar levels. And that through diet and exercise, you can also help get some control there.
Okay.
We also had a social worker come to see you and tell you about some of the different programs out there to help you afford your medication, but also to give you some help with other costs in your life, and just help increase your income, to help lower your stress levels a little bit as well, because we realized how stressed you really you've been under a lot, and which is why we included yoga, meditation, things to help relax you, because we want to reduce the stress in your body, because your body needs to spend its energy on healing, but also because your emotional health is important to your overall wellness just as much as your physical health is.
So like, what do I do when I go home? Like, I know you're telling me all of this, but like it's a lot, and I'm not gonna remember any of this. Like, can we get my mom up here? Maybe she can listen to it too.
Absolutely. I'll go get Mom. I'll come in. Okay, I'll be right back.
Okay.
Hi, Mom.